You are in for an extraordinary treat today. I have a guest who is an iconic dietitian. She is both a retail dietitian, but you might also know her as a very well-known podcaster. Anne Elizabeth, welcome.
Hi, Stacey. Thank you so much for having me today. I feel like I'm sitting with my bestie, like
Uh,
bestie that I haven't been around in a long time.
I know. You interviewed me many years ago. I think it was pre-COVID, and we got to meet in person at Fancy. And you're in my ear all the time. So I do feel like you're in my pod of people. So welcome. I'm so delighted that you are here with us today. So you and I both share a LinkedIn headline element. We are both dietitian cheerleaders. We're both invested in our fellow dietitians, the career paths of dietitians, and I think really just expanding the possibilities for dietitians. In fact, you're so invested in dietitians that you started this podcast 10 years ago, Conversations with Anne Elizabeth. Iconic.
10 years. I cannot believe it's been 10 years. Holy smokes.
Well, thank you for paving the way for all of the rest of us. And I have to say, it's such an honor to be on the other end of the interview chair and be able to have a conversation with you and get to ask you some questions.
I'm excited to be here.
So tell us a little bit about how did you get excited about being a dietitian cheerleader? So tell us a little bit more about that.
Absolutely. So I've been a dietitian for a few minutes, which I'm not going to date myself, but at the time, there wasn't all this awesome resources to connect with people. We didn't have the Zooms, we didn't have all those places that we could connect. And so it was my own personal desire to connect with other dietitians in other spaces. So trying to find that way to just have conversations. I loved the people I worked with, but I wanted more, and I wanted more experience with what other dietitians were doing. So that's kind of how I just kind of started making my own little girl group and finding people all over the United States to try to connect with and just root them on and help them out and be that cheerleader for them.
I think that's so true, though, about what you said. There aren't too many dietitians in the country, and we're not all living next to each other. If you work in a hospital or a traditional setting, you might have a few more that you hang out with that you see. You'll see some at conferences, maybe local dietetic associations or your state affiliate or the national. But you're right, like you just don't have a lot of connection with a lot of dietitians. And I think that's a really important element of feeling connected to the profession, maintaining the longevity of the profession and elevating it. So I'm glad that you had that idea as well. So your professional background is in not just in podcasting. So tell us about your background, what type of work what you're doing now, and what brought you to the profession of dietetics.
Sure. Well, as I was going through my college journey, I thought I wanted to be a doctor, which I'm sure you've heard that many times from lots of dietitians that, thinking they want to go into the healthcare field. So it's either a nurse or a doctor. So I was on the doctor path and I had an elective class that I was able to take. So I took a nutrition class and the professor was a dietitian. And I was in there with PT students, OT, nurses. I was the only kind of pre med person. And I was enthralled with the content. I loved her as a professor. And so I just wanted her to tell me more about being a dietitian because I'd never heard of it before. And so Deb, it was my professor. She was in cardiac care and she did this as an adjunct position and she really got me interested in the field. So I decided from that class on that I wanted to be a dietitian. And I just kind of did everything to find out how to do that. And it wasn't easy because my school did not have a dietitian degree. So I had to finish my biology degree, had to go seek out all those extra classes, the didactic classes, the internship. I had to kind of do that on my own. I didn't have a lot of guidance. She definitely helped, but she was only one person and had a family and all the things. And so that's what led me to the dietetics profession. Now I sometimes think, I'm like, ooh, I probably should have just been a doctor and focused on nutrition. But, hindsight's 2020. And then that just led me to the internship process. And during that internship, I worked with a great group of women in a clinical setting in Omaha, and they hired me kind of halfway through my internship. So worked in clinical for about 7 years. And I loved clinical, a lot of knowledge, but I just wanted to get out of sick care. I wanted to kind of get into that more preventive healthcare. And again, at that time, there just wasn't a lot of spaces for dietitians to get more into that preventative healthcare. And there was a retailer in the Midwest that was hiring dietitians in the grocery store. And a friend of mine from my internship, she had been working with them for about a year. And she knew that I was in that space of wanting to work in preventative health. And she just kind of gathered me in and said, "You need to apply for this." And I did. And the rest is kind of history. I've been doing retail at, in the grocery store as a dietitian for the last 18 years.
You said something that made me think a little bit about our profession, and that is mentorship. You had the mentor in your undergraduate situation, and again, bringing another dietitian that was mentoring you into the position that you had with the retail position. I think mentoring is so helpful. How have you been able to mentor other people besides the podcast? Because I think that is in some ways a mentorship right there. It's a indirect mentorship, but have you been able to give back as and being a mentor as well?
Oh gosh, I think mentorship is, that's the key to where I think most of us get our jobs and our interest and our expertise. So that's something I've been very passionate about because the gals who mentored me, I just couldn't be more grateful for. So I definitely have always put that out into the world that I would always love to mentor other people. So, of course, interns, always a big place. I'm always open to taking interns. And I feel like that's gotten a little bit restricted lately. I think a lot of dietitians aren't taking interns, and internship programs are getting smaller and they're not even viable anymore. So I feel like that is one place that we really need to shine in all aspects outside of food service, clinical and community, having these niche areas that you can be a preceptor is so important. So that is definitely an area. I can't even tell you how many interns I've had. I just saw one of my interns just had her like 42nd birthday or something. I'm like, oh my God, I remember when you were like 22. Like, oh my gosh.
That's fantastic.
I also think it's super important to volunteer for your state affiliate or, a local district affiliate group that you have locally with you, because I think, again, that's a space where students are going. They want to find those individuals in their community. And it's a place that you can get some great experience to learn how to be a good mentor too. Sometimes it doesn't come naturally for people. So it's a nice space that feels good and comfortable, but also is supported with other mentors. And then you can find people that are looking for that mentee.
Uh, yeah, yeah, I like that. And also just even more informally having informational interviews with other dietitians. It's an easy lift for dietitians and also those who are and dietitians within dietitians who want to learn more about a different niche area or want to go over some ideas that they have. Whether you're a student or a seasoned dietitian, I think that's another way to approach sort of, mentorship in a way. So when I was a brand new dietitian, there was a job opening for a dietitian in a retail space for a grocery store, and I thought, "Holy cow, that is such an amazing position!" At the time, there was only one opening, one job in that entire chain, and I just thought that was the coolest job ever. And this was during a time when there weren't that many non-traditional jobs. So I still believe that working in a retail setting as a dietitian is very unique, non-traditional. What does that entail? What does a retail dietitian do?
It's definitely ebb and flowed over the course of my career. I think the biggest thing that always surprises me about being a diet, it's like a pinch me. Like, I'm really a dietitian in a grocery store. Like, this is a thing. Like, this is a job because it is so important to be where food matters to people. And that is in the grocery store. And you're at that point of sale. You can help immediately. You can be that person that helps them with their food choices and what they're going to have for dinner. It's just a fantastic spot. So that has always been the pinch me thing of I can help people right then and there. But it's also evolved into so many different things. And I think depending on your retailer is kind of depends on what that looks like. Demographics have a big part of that too. What happens in the Midwest where I'm at could be completely different on a coast. So it's basically being really in touch with community. So community nutrition is a huge part of that. But then you kind of have to know everything. You kind of have to be the have all the bag of tricks ready to go because you just never know what you're going to get. And so thinking of that clinical past or those experiences that you have with other places in the workforce, they really do lend to how you support your community as a retail dietitian too. So definitely that dietitian component is always there, except you have to be able to pivot and to help a variety of different people. It's just a space where people know you. So it's like people know I'm their dietitian. They're like, oh, there's Anne. She's the dietitian for me. That's my dietitian. And so it's awesome to have them resonate with me that way.
All right. So give us a picture of like a day in the life of Anne at the grocery store. Maybe it's one day or sort of consolidated over a week. Do you wear like a lab coat or anything, or do you look any different on, you don't have a grocery cart, obviously.
No, I don't. Sometimes I do, depending on what I'm doing.
Yeah.
Signage that definitely might have a grocery cart, but we've done all of it. I've wore a lab coat before. Most of the time it's just professional dress. So you look like the store model has in our group, we have managers that fit all the roles in each department in our store. So we look like one of the managers because we're in professional dress. We do have different little name badges that also kind of signify that we are one of the professionals in the store. But the day to day, that's what the best part is about the job. It's never the same. So, you can kind of have a schedule set, but you know that if your door's open, you're going to get kind of anything and everything that day. And that can be from customers. It can be from my coworkers. It could be from my boss at the corporate office. It just kind of depends on what that day looks like. But a lot of it, I'd say 60 to 70% is patient care right now. So I do a lot of nutrition counseling. Our model, we do take insurance. So that has definitely had an uptick in how we can get referrals from physicians and help people with their medical nutrition therapy needs. So in person, virtual, we have that capability, which is lovely because we get to reach a lot of people. I'm in Iowa, so a lot of rural communities that we work with that don't have dietitians in their, in 60 plus miles away from them. So we can access a lot of patients across our state, which is a lovely advantage for us. And then for the people of our state. So yeah, about 60 to 70% is my patient care. And then I also kind of focus and I've evolved over the years. I kind of head our worksite wellness program, so corporate wellness that we do with businesses and all the communities that we are in. So our dietitians will go and do health screenings at businesses, provide that point of care testing, go over the lab results, tell them about risk factors for their future health, and then hopefully kind of continuing that conversation to working with us to help them with their health. So I am the one that gets to kind of have those big meetings with all those employer groups, coordinate kind of the on-site testing, scheduling the dietitians, and then doing the follow-up of invoicing, billing, kind of all the ins and outs of that program, which has been a really fun part of my job. And then probably the other little part of my job is just community involvement. So making sure that I am being part of my community in some way, shape, or form, whether that's attending, events in the community, supporting health fairs, supporting the chamber, just kind of like having that connection of where I'm at. So then I can be seen as that professional nutrition resource for all types of people and all types of groups.
Okay, I am blown away by all that you do. I think again, back to when I was a new dietitian, thinking that the job would be primarily slicing fruit and, and doing grocery shopping tours. I love this. I love the elevation of the dietitian. I love the direct patient care that can be provided. I love, of course, the community outreach that makes sense. All of this is just fantastic. Are you involved in any of the marketing for these services, or is that done for you?
We definitely have a big say in what that marketing component looks like. We obviously have wonderful people at our corporate headquarters that helps with the design and kind of putting that all together. But as a group, our group definitely does kind of help with all that designing, the verbiage, color schemes, that type of stuff. So marketing is kind of been a big component because we are kind of our own marketers in the sense that we get some corporate support, but a lot of that is even just our own voices, our own contacts, being that face out in the store and letting people know what we have going on. So we still do have some events, we still do cut up fruit sometimes. I'm never opposed to whipping out, like if someone's like, "Ooh, I want to try that new fruit." I'm like, I'll go get a
Right.
date. We can try it right here. Like I'm totally fine with that. Same way with product, which is fun. So that is still part of a component because again, we want to make sure that we're talking about food where it means the most. And sometimes it is opening a package or sometimes it is cutting up a piece of fruit.
Thank you. That was amazing. That's really interesting. I am now thinking about other dietitians who are listening and are thinking, "Oh my gosh, this is really interesting to me. I'm very interested in this area that we can work as dietitians." I'm thinking about the tools that you might use, like computer tools or applications. Are there specific tools that you like to use or that you find helpful to be successful in your position?
I would say there's great tools out there. Your biggest tool is yourself in a grocery
Mm.
store. So I think your personality, it has to be one that is kind of outgoing. You like to talk to people. You like people. That's always a good bonus too. So I think like as a tool, you have to utilize yourself as your biggest tool when it comes to making those connections. And then also, again, the marketing piece, being that face in your community of nutrition. But then, when it comes to the stuff behind the scenes, of course, for me, it's a lot of, invoicing, it's data sheets, it's Excel, it's that type of stuff that I'm doing tracking. I think as far as my own, thinking, I know a future question we're going to talk about, is income and salary. It's good to track what I do because I'm a one man show in my space. So I have to be the one that's my biggest advocate. So I utilize Excel a lot to track kind of just things that I'm doing. And then Canva, I mean, you can't beat Canva. Canva's great to like do one-off flyers or like do something quick that you can put up in the store that you're not going to get that support from maybe marketing because that's a bigger entity. And if you just want to do something small in your space, you can just use Canva to have a fun little flyer.
I love that you brought up the tools of being able to document the work that you're doing. Think it's very important as a dietitian, as our profession, to be able to not just talk about our worth and what value we provide, but actually provide some empirical data, provide some documentation of what that is, outcomes. So thank you for sharing that. Are there any other outcomes that you share at either your performance evaluations or any maybe other retail dietitians, like what they might be sharing as far as validating the work that they're doing?
Well, in our space, I mean, we are in a retail setting. So we are kind of like the outliers of what the business is actually doing. I always have to remember that I still have to know the retail space and how that functions to be able to do my job in that business. So I have to put on my retail hat, just like the meat department manager, just like the produce manager. I still have to have those kind of goals, sales goals. I still have to have, you know, I have to watch my hours. Those kind of things are all part of being a good steward of being a retail dietitian. So definitely keep track of those things as a retail dietitian because it's like having your own little business inside of a grocery store. So if it was my business, how would I track what I'm doing? Are my sales, kind of matching up my what I'm being paid? Am I bringing in the right kind of revenue? What's the ROI on my services? So keeping track of that is super important. Maybe that'll never be asked of you, but if you ever is, that is something that you have, and you can show that documentation that you have been providing services, and this is what that looks like.
I agree. I think you hit on something that is really important to think about, and maybe it's a little bit of a transitional switch of mindset, but that is to be thinking like an entrepreneur. Like your position, your business has to stay viable. How does that happen? it's all about the revenue and how the sales, whatever that might be, being able to document that and think about that. So I'm actually very curious about you and your skills. I just think you have a tremendous smorgasbord of different skills that make you such a successful dietitian in so many different elements of how you've been working in corporate wellness and community, retail, podcasting. Maybe you can share with us some skills that you were born with that have made you enjoy and be successful in the work that you're doing, and maybe some skills that you've learned along the way that you can share with us.
Sure. Born with, my mom will always, if she was here, she would love to share this story. But when I was young, my grandmother gave my mother a book called The Strong-Willed Child, and that was me. So I would say one of the skills I was born with is I am very strong-willed. I'm sometimes outspoken, so I've definitely learned to kind of curtail that. But it is something that to be in the retail setting, you really kind of have to be a strong-willed child because you really have to be an advocate for yourself. You really have to be able to get into the weeds and not be scared to, talk to someone about your job, talk to someone about your worth, talk to someone about why I should be here. So that has been a skill that I thank goodness I did have because I don't think I probably would have lasted in retail if I didn't have that after those first couple years because it was tough. It was tough to kind of and people, the produce manager, they don't know what you do. Like they didn't know what I did when I started. And that could be the case for a lot of future retail jobs. There might have never been a dietitian in the position that you're being hired for. So you kind of have to be able to kind of wiggle in there and just kind of, yes, I'm a dietitian. This is what I do. What I love to work with you. This is how I can help you and support you. So that's been a positive. I have curtailed my outspokenness. So I actually think about things before I talk now, which is good. Being in the retail space, again, kind of going back to having the ability to adapt when you're needed. The retail space might need help in the bakery one day, and you might need to go back and package up cookies. During COVID was a whole other animal because we just, as a dietitian, no one was coming to see us, but the shelves needed to be stocked and people needed support. And we kind of shifted into that role as retail dietitians. We weren't practicing as dietitians, but we were practicing in a community of being supportive of our coworkers. So what I've adapted to as a retail dietitian is to be a team player in a
Mhm.
place that isn't full of dietitians. And how can I support my coworkers in that space? But then also, I think you got to be a little bit open to being good at public speaking, being good at media. And that's something that I was not good at when I started. I was in clinical, I was behind the scenes, I never did any interviews or anything. So that was kind of a new adventure for me, getting media trained. Thought that was the most beneficial thing I could have did at the time. So I could be a better public speaker, better at, TV interviews. I was terrible at it. I just had sweat running down my back the whole time. And I'm just like blank stare. And it's good that you get that experience and just know that if you go work in that retail space, anything is on the table. So you've got to be ready and you've got to be adaptable to that.
Those are fantastic insights. I appreciate that. I also can relate to the media fear. I used to work with Dr. Dean Ornish, and he would get called upon all the time to give media appearances and presentations all over the world, all over the country, MSNBC, CNN, like all of the news shows, Oprah, etc. I knew that when I got called into the office and said, and when he would ask me, like, what are you doing tomorrow? I'm like, why? What's happening? Where am I going? I don't want to do this.
Oh my gosh.
And
Yeah.
there were
Yes.
many times where that's what you had to do. Yeah, you had to go to the studio at the time. This was, so like 20 years ago, 15 years ago that you had to actually go to the studio. So I had a lot of amazing opportunities, but I could have used some media training as well and just had to watch him and watch his recordings and learn how to do it from his perspective. And I learned that you don't always have to answer the question.
You can kind of talk around the question.
You could talk around as long as you have something valuable to share. But I love that you sought out media training on your own. I love all that you shared. I also want to put a pin in the idea that always be thinking like a team player. I know sometimes we have to get like really strong and be advocates for ourselves and our profession and be able to make people recognize the value that dietitians can provide. But being a team player is really important, whether you're working in a traditional position or you're working at WIC or you're working in a hospital. I think having that team player mentality where everybody is here in a job that can disappear any day, and to be able to support the team, to be able to support the company in the bottom line, and just like you said, like stocking shelves, that may not have been where your expertise was, but that's what's keeping the business viable because that's where your paycheck is coming from eventually. So I like that you shared that as well. All right.
And two, I just have kind of point to about the one store, I cover quite a few different stores, but at one store, there's 400 employees besides me. So who's going to be a bigger advocate for me if I make those connections? So free advertising. If the little guy on the front end that bags the groceries, someone's talking about a dietitian and he knows it's me, like, oh, I know Anne and she's awesome. And she's nice. She says hi to me every day. Like, again, they're going to be your biggest supporters. So you got to be on their team.
I love that you shared that as well because we think about networking within our profession and making sure that we're connected with people. But same is true for where you're at every day, networking with your coworkers, even if they don't do the same type of work that you do. But having them know who you are, if an opportunity comes up, then they think of you, you're top of mind. Yeah, so I like internal networking. That's really helpful. That's a good skill. All right. So I want to switch gears a little bit and talk a little bit more about money. And as you and I both know, we're big advocates of dietitians and being able to earn more money as dietitians. But some of us are not satisfied with their positions and the amount of money that they're earning. So, what recommendations or advice do you have for the profession or for individual dietitians about how we can make more money as a dietitian?
I mean, I always say the sky's the limit about making more money. So I think a lot of times we feel like we have this glass ceiling above us because dietitians only make this much and this is what you're going to get and this is your raise and et cetera, et cetera. We can't expect money to come to us. We have to be able to show why money should come to us. And so I think it kind of goes back to tracking, kind of showing your worth, especially if you're in a W-2 job and you're kind of doing all the things. If you're just doing the bare minimum, then you should get the bare minimum. And I do kind of feel that way. Like, I feel like as dietitians, sometimes we feel like, well, I'm a dietitian, I'm a professional, I should just automatically get more money. And that's kind of not the mindset that I have because I also want to be a good dietitian. I just don't want to be an okay dietitian. So if I'm to be good or great, I have to show what the good or great, what I'm doing to be good and great. And so I mean, even if you're not tracking it in an Excel sheet, if you kind of track the things that you do, whether it's educating yourself more on a certain niche area, like you've gotten a different certification or you've gotten something that you've specialized in. Those are the things that you need to bring to your reviews to tell them what you've been doing behind the scenes because they're expecting that you're meeting everything in your job description. What are you doing outside of your job description? And that's maybe what you need to track more of so you can prove that you are just doing better for the company, basically. And then what are the other things like going over and beyond? Are you doing something else in your workplace that it doesn't get a lot of recognition, but maybe you're doing it all the time? Maybe you're helping, just in our store. Maybe I go deliver someone's groceries because they're slow in the back. I just kind of make notes of those things. So then I can say, I spent some time doing this with this group, or I did this on a different day outside of my dietitian day to day. So I think it's important to highlight the little things as well as maybe the big things. But it's always good to have notes. It's always good to bring things to your reviews, and documentation will always beat any verbal communication that you provide with your boss.
I'm a huge evangelist for the work journal, and every month I try to highlight the work journaling just to document your successes. Some of those successes will go on to your resume or your LinkedIn profile, or if you have a big, massive curriculum vitae. but just having that work journal all the time, because it is so hard to remember what you've done a month ago, 2 months ago, a talk you gave, or if you gave a community outreach and you had people call a specific number, or you had like a coupon code for them, and then you were able to say that, oh, this number of people came in for that event that I did that was a free event, but this is how many people came in. These are all things that would be impossible to remember what you did like 3 months ago, but all of these things can add up to documenting your value. So I appreciate that you're sharing that as well.
Well, I use your work journal. Like I remember I love yours because I even shared it with all my dietitians in my group because I said this is the thing that's going to help you remember all the things that you do in a day.
Yeah, it's hard. It's no fault of yours if you can't remember it, but just think about your future self, whether it's a month from now, a performance evaluation, as you mentioned, or if you're going into your boss or your grand boss like a month or two ahead of your performance review when your raise has already been determined. So go in ahead of time and document what, sharing that with them, what you were able to do. So thank you for that. I appreciate that. All right, I'm going to turn the tables a little bit. And I love how you always end your interviews and your conversations with other dietitians talking about more personal stuff. All right, so tell us, what is your favorite beverage? So I want to hear like your AM, your morning beverage, and your PM, your evening beverage.
Oh my gosh. My favorite beverage in the morning is a green tea and a mint tea mixed together. And it's like non-negotiable. I have it every day at around 8:30 a.m. when I get into the office. And that is how I kind of start my morning. Water is usually before that, but that is a non-negotiable in the morning. And then PM, I am really lame. During the week, it's just water. On the weekends, it'll probably be a glass of champagne.
Oh, champagne. That's a good one. I love celebrating the week. I love
Yes.
that. That's good. And then tell us about your favorite scent. I think it's a really great question that you ask everybody because the responses are always hilarious. I think just the nature of the question, I think, is funny. So tell us what your favorite scent is.
Favorite scent is I love when I'm walking around the neighborhood and I can smell people's dryers and their fabric softener. It is like so fun. I'm like, ooh, yeah, Downy. That's Gain. I can totally tell the difference of them. So that's one of my favorite scents. And then another favorite scent that I have is always like homemade bread being baked. I think it's my grandma used to bake bread all the time. My mom bakes bread. I just love the scent of homemade bread.
Ooh, that's a good one. I love that. I remember you asking me many years ago when you interviewed me, and mine was the essence of Lang Lang because I just think it smells so good. But I have like this funny story about it. When I was going to deliver my first of 3 children, I had this very elaborate birth plan and thought I was going to be unmedicated and that Lang Lang was going to help me get through labor. Little did I know that did not help. Anne Elizabeth, what a treasure. What a treat. Thank you so much for playing a very important role in our profession. How can listeners connect with you?
Absolutely. Well, I'm on the interwebs. Obviously, I'm on LinkedIn, Instagram, all the places. I'm Anne Elizabeth RD. So that's my little hashtag for everything.
And then always, everyone, you have to listen to her podcast. It's very insightful. I always learn about what other dietitians are doing. It's a wonderful resource, and that's a great way to connect with her there as well. So, Anne Elizabeth, thank you so much for today.
Thank you, Stacy.